Hey friends, welcome back to the channel in another video. My name is Dr. Caroline, a practicing board-certified family medicine physician, and today's video is a little bit different compared to my usual productivity type videos, although we'll sprinkle a little bit of that in there. But today's video is focused on the transition from residency to attending primary care doctor. We all know that there's not a manual out there to guide one through the transition from resident to attending, so everyone will probably have different experiences during this transition. So in today's video, I want to share some tips that helped me make my transition smoother. So the first tip, and a very important one I believe, is have confidence in your abilities as a doctor. Have confidence that you have had great training and believe in your abilities as a doctor. Of course, there is always going to be more to learn, so I don't believe that this should be a reason for one to not feel ready. You don't need to have everything figured out or have seen and managed every case under the sun to feel ready to be an attending. That's why it's called practice, because even as an attending, you're essentially still learning and fine-tuning your skills. So have great confidence in yourself and just move forward from there. The second tip is know your practice preferences. This is something I would suggest to start thinking about as a third-year resident, especially in the last 6 months of that year. What kind of practice flow do you prefer? So for example, what tasks do you want your staff to have done prior to you seeing your patients? How do you want to manage your admin tasks, and what level of involvement do you want your staff to have? Now, if you've already started as a new attending, that's fine, but try to establish this preference list sooner rather than later, because early on as new attending, your patient volume is likely not that high because you're building it up. So this is a great time to have your staff learn how you like things to run. This will help immensely in the long run, especially as your patient volume ramps up. The third tip is create note templates, smart phrases, dot phrases, everything along those lines. Now, hopefully you would have had experience creating these as a resident, and so when you're starting out as a new attending, you want to get these things sorted out very early on, especially when your patient volume is still fairly low. This will make charting so much easier and faster, and will certainly help with efficiency and productivity moving forward. The final tip is pace yourself when ramping up your patient volume. So again, in the beginning, when starting out as an attending, you're usually given time to build up your patient panel, so you're probably seeing patients like every 30 minutes. Then when you're ready to ramp up, you will likely maybe cut down on the amount of time per appointment. But this is where you want to pace yourself. Ramp up slowly to ensure that you're able to manage each ramp up of volume. This will also help to avoid early burnout. And this is another reason why I suggest having your practice preferences established very early, because when your patient volume increases and you get busy, you want to make sure that you have a well-oiled machine. You want to make sure that your workflow is solid. It makes seeing a higher volume of patients so much easier. Alright friends, I hope this video was interesting to you. If you liked this video and you enjoy this type of content, then consider subscribing, because I do post a video like this every single week. And if you are in the phase of trying to figure out how to maximize productivity and scale your income as a primary care doctor without overworking, feeling overwhelmed, or risking burnout, then certainly check out the link below to our review consulting program to learn more. Thank you so much for watching. Make sure to leave a like and share this video with your colleagues. I'll see you next time.